Who do you think you are that you can hack our biology? We have literally evolved over millions of years. Your supplement is not going to do that.
Accredited nutritionist Dr Federica Amati is here to share her evidence-based advice.
So we can actually now do the science to say the food choices we make every day have the power to impact how we feel today, plus the impact to prevent disease and to make sure that we feel better tomorrow.
She's head nutritionist at personalised health company Zoe. You can be confident that Dr Fede's advice is backed by the science.
The foods that people are eating with this Mediterranean dietary pattern is directly impacting gut microbiome composition, and that's having the health outcome that we're measuring.
What do you think some of the challenges are to good nutrition?
There is this culture of it worked for me, so it's going to work for you. That's really dangerous.
Yeah.
Just because it works for one person, it does not mean it's going to work for everyone else.
Health is the new wealth.
Yes.
How do people get rich? Hello everyone, and welcome back to Vision of Health, the podcast where I talk to qualified experts about what being healthy really looks like in everyday life. I'm Dr. Frankie Jackson-Spence. I'm a medical doctor specialising in cancer research. My mission is to bridge the gap between science and real life, offering you practical advice to help you improve your lifestyle that is actually backed by the evidence. I'm Dr. Frankie, and this is my Vision of Health. You may have noticed that the nutrition advice you seem to read seems to take a one-size-fits-all approach. But what if the way we metabolize food is more individual than the marketing claims will have us believe? Accredited nutritionist Dr. Federica Amati is here to share her evidence-based advice. In this episode, Dr. Fede translates her wealth of scientific knowledge into practical ways we can harness the power of our diet and microbiome to improve our overall health. Thank you so much for coming on Vision of Health.
Thank you so much for having me. I'm so excited to be here.
I'm so excited to have you on. I couldn't believe it when you said yes.
Oh, no, I think what you're doing is really great.
Thank you. I'm going to get straight into it because I have so much I want to ask you.
Yes.
I've recently been reading your new book and you are just a fountain of knowledge. So I really feel like our listeners are going to learn so much. And also, so many people do speak about nutrition. And often when you listen to things, I think there's lots of things people have heard before. But when I was reading your book, there was so much that I was learning for the first time, which is really refreshing. So
that is great to hear.
Thank you for writing that. So nutrition feels like such a minefield. Where should people start?
It's a really good question. So I think it's becoming noisier as we go on. So it's this field that keeps growing with people who have an opinion, I guess. And one of the ways that we can really differentiate where we can get evidence-based, trustworthy advice is by looking at people's qualifications. So I'm a registered nutritionist. I did a master's in nutrition on top of my other degrees. And as a registered nutritionist, I have to keep up my education, make sure I'm continuing my research, contribute to the field as well. So registered nutritionist is a title that's accredited to people who enroll with the Association for Nutrition. And unfortunately, it is not protected by law yet. And that's something that we're really trying to change, because really you could take a one-day course in nutrition online and call yourself a nutritionist, and that's legal. Registered dietitians, on the other hand, that is a legally protected title. So when you're speaking to someone who has RD, registered dietitian, that's their name, it means that they have this background and the education and the clinical expertise to work with you on giving you diet advice and advising you on what foods to eat. And specifically for RDs, they work with people who have ongoing health conditions. So for example, Frankie, if you have a patient who's undergoing chemotherapy, you would need an oncology dietitian to work with your patients. So those are the sort of two groups of people who have an education in nutrition. And therefore, if you're looking for advice on nutrition, it's advisable to look to people who have that kind of background and that kind of education. Now, of course, there is really valuable information to be had from other healthcare professionals as well. I would just say that if you're really looking to improve your overall health and you want evidence-based advice on which foods to eat or what dietary pattern to follow, then it is best to opt for a nutritionist, preferably a registered nutritionist, and or a registered dietitian. That would cut quite a lot of people out of the picture. And then, you know, some people may say, yes, I know, but I have a really excellent doctor who's really interested in nutrition. And there's functional medicine, which is it's a growing space as well. And British Society of Lifestyle Medicine represents a huge group of medics who are interested in lifestyle and diet as a way to prevent disease and help their patients. So it's not to say that if you have a GP who's really interested in prevention and they've actually gone out of their way outside of their working day to learn more, their advice is likely to be really helpful. And so I think we should really encourage and embrace doctors and nurses who are taking the time out to educate themselves more for their patients. But I guess I'm referring more to the online world. On the online world, and because it's so noisy, and I hear TikTok is the worst. I'm not a TikTok sort of person, but I hear that that's where the craziest things come out. On those platforms, I think really try and find out, where is this person working? What is their affiliation? What is their title? What is their background? And then based on that information, you can decide whether to take everything they say literally or whether maybe take it with a pinch of salt.
Yeah, I think as well, people share their own experience. And so you can look at how someone you might look up to eats, but it doesn't necessarily mean it's going to work for you.
Oh, yes, the N of one, right? Yes, it's like this. There is this culture of it worked for me, so it's going to work for you. And there are some very famous examples of that who have built entire empires around it. And so I think that's really dangerous. Because we know that an N of one does not equal, like that's not what we base our N of one, meaning just because it works for one person, it does not mean it's going to work for everyone else. And there's a word for it. So it's just anecdotal evidence. And anecdotal evidence essentially is a story about one person. It is not used in making any kind of decisions. So whilst it's great to hear individuals talk about how they've managed to transform their health, and it's encouraging to see the impact that diet and lifestyle can have on individual people's like happiness in life. It does not mean that we should copy what they've done for ourselves, because that's not really how it works.
I think nutrition gets a really hard time because I don't often see people stepping into my lane and talking about oncology topics
Thank God.
Aren't qualified. I know, but then that aren't qualified. People don't really do that. Whereas nutrition, many people think they have a voice. And I think it's because we all eat food and we all love food and we have experiences, but it does make it really noisy. And I would say even as a medical professional, I sometimes find it difficult to know who to trust in that space because everyone seems to be selling something and everyone seems to have a really strong opinion. So thank you for putting out evidence-based and kind of impartial evidence
thank
out
you.
there.
Yes, that's my goal. And I think actually there are people who put out really dangerous stories about oncology and cancer and, sort of made up treatments. But to your point, Frankie, I think it's one of those things that is called out very quickly. And I think most people know that if they are suffering with cancer, if they're at risk, they would go to a trusted specialist, go to a doctor, an oncologist. And hopefully, there's this really nice analogy, isn't there, where you wouldn't ask your electrician to fix your car. So why are we expecting people who have no training in nutrition to help us fix our food, like our diet, and help us with that? And it's the same thing. It's like with every specialty. It's like if I started to, please call me up if I do this, but if I started to sort of, I don't know, speak about the importance of, well, even, like if I started to give advice on which drug for cancer people should be taking, it would be way out of my lane. And it's just not something that I think the majority of healthcare professionals wouldn't do that. So those of us who really care about making a difference and a positive difference in people's lives, try to stick to what we know best and support others who are doing great work in their own fields. So that's actually another really good way to see whether someone's doing good work is, are they supporting others who are doing really good work in their field? And what we were chatting earlier, and we were saying there's so many women in this space now, and it's so amazing to see the camaraderie and the support that we feel. I honestly feel like I've made some amazing friends through this network in the past sort of 5 years or so. And I think that's a really good sign. So if there's one person who seems to be like against everyone and supporting no one, what is that? Like, what's going on there? That should, I think, make people a little bit wary.
Absolutely. And that's kind of the whole basis of Vision of Health. I have 10 episodes each season where I can interview people that are more expert on these specific topics than I am, and really kind of extend that to my audience. So I think I completely agree with you. So when it comes to what we're eating, it's so complicated. We have an obesity problem. We have, rates of pretty much every disease on the rise. And I feel like something must be going wrong with our nutrition. What do you think some of the challenges are to good nutrition?
I think, there's some really big challenges in terms of the food environment. And so you're completely right. There's this massive increase in chronic disease, and our modern lifestyles, which includes our modern diets, are just not supporting health at the moment. So, some estimates suggest that up to 80% of chronic diseases could be prevented and early death just by 4 main lifestyle and dietary interventions. So it's not smoking, which still needs to be said because people still smoke, and vaping is clearly becoming just as big of a problem. Drinking less alcohol, moving more so being physically active. It doesn't mean any specific type of exercise, but just being physically active throughout the day, and then having a healthy diet. And a healthy diet here, people always say, but what does that actually mean? And I think the evidence is super, super, super crystal clear that a healthy diet is essentially a whole food-based diet, which is primarily made up of plants. It doesn't mean you have to be vegan, but there is a big focus on eating more plants with a little bit. So a side of meat, a side of fish, a side of eggs. So those 4 things are, I would say, things people are aware of. We know we shouldn't smoke. We know we shouldn't drink too much. We know we should move. And we sort of all know that we should eat more fruits and veg, right? But it's just not happening. So this is where public health really comes into play, right? Individual agency gets you so far. So my daily food choices, my choices of how I get around get me so far. But so much of that is dictated by my environment and by what I have access to. So obviously, I'm really fortunate. I have access to being able to buy what food I want and need for my family. I have access to moving around however I choose to move around. But for lots of people, that's not the case. And they depend much more heavily on their environment. So if you imagine that now we have an overwhelming amount of foods that are just not really helpful for health.
Well, they're not really food.
Well, yeah, I think I'm wary of not calling it food because for a lot of people, it really is. Their food. It's food. It is food, right? It's food products, let's say. So you're right in the sense that you can't grow them out of the ground. And it is not what we have evolved to eat as food. But there's so much of it everywhere. Some places like gas stations, for example, it is all there is. There is no food. There is just candy bars and crisps and sodas and energy drinks, and it's just endless rows. Even when I was growing up, I remember that wasn't the case. There'd be maybe a couple of rows of that, but the majority of supermarkets were made up by Whole Foods, and it has changed so quickly, and it has changed in a way that I feel like there's been no thought put into what happens if you change the food environment that much. And what we're seeing now is that people are consuming the majority of their calories from ultra-processed foods. And ultra-processed foods, or high-fat, sugar, salt foods, or packaged foods, however you want to call them, ultra-processed foods does capture all of those into one group. To have the majority of our calories come from those foods is wild.
It really is.
It's wild, especially when you take a global lens, because we are the worst country in Europe for that. So if you look to countries who are doing much better than us, Italy, I'm not just biased, it's the truth. But we consume in Italy about 14% of our calories come from ultra-processed foods. Here in the UK, it's between 55 and 72%.
Wow.
That's a huge difference.
But I get it, because when I walk into a supermarket, sometimes at the end of a busy day, and you walk into a fruit and veg aisle, you're like, what do I cook? Yeah. And then on the end of the aisle, bam, in the middle of your eyes is a ready meal that looks semi-healthy. Yeah. And it's I can see why it's so much easier to grab that and be out of there than start thinking, oh, I need a little bit of this. Oh, do I have this spice in the cupboard? Yeah. Do I have milk? Yeah,
all the ingredients. Yes, and I think, so it's the food environment is one piece. Yeah. But then the way that our work and life environments have been shaped is also quite unsustainable, right? So many of us work quite silly hours. So even though we have more flexible working now post-pandemic, most of us end up probably working a bit more, is what I've kind of heard a lot. So you're working really early in the morning, then perhaps you have family or you have other commitments. So, I mean, Frankie, for example, for you, you're doing a podcast, but you're also at events and you're also working clinically. So we all have lots going on. And what's happened is that we've lost our food culture here. Mm-hmm. So, you travel to Europe and there is always time to make a meal. It is because it is part of the day. Like it is the non-negotiable thing. So one of the things I suggest in my book is, just try to take 1 hour of your day. You have 24 hours a day. Let's hope that we're all trying to get 8 hours of sleep. Split the rest of the day up. And there should be an hour, even if it's not in one whole chunk, even if it's like 20 minutes. But we should really have that time to make sure that we can create a healthy and nourishing meal for ourselves and for our family, if we have a family, and make that the priority because it's so important.
Yeah.
It is so important for our health. So there's some crazy statistics about how many hours a day we all spend on social media, how many hours a week we all spend watching streaming channels, Netflix. So I think the issue is that there's so many competing things are competing for our attention all the time.
Yeah.
And one of the things I say a lot to my clients when I work with them one-on-one is I say, this has to be your priority. It's not really negotiable. So it can't be moved. Put it in your diary, put it in your calendar as an actual meeting.
Yeah.
And don't move it if that's what you need to do for your schedule. And for those who are even more time poor, who really are struggling to actually find the time, that's where we do need the food environment to change. So there's always going to be place for ready meals and processed foods, and supermarkets are always going to lean towards creating convenience for us because people buy convenience. But we need to sort of revisit this and see, but how can we make these foods less harmful?
Yeah.
Even if they're still not going to be as healthy as making it like a home cooked meal from scratch. But there are ways that we can dial it down, right?
Yeah.
It's gone too far.
All there's compromises you can make. Sometimes when I'm really in a rush, I might grab something like, those microwavable rice packets.
Yes, they're brilliant.
They're brilliant, but it means I probably then buy a piece of fish, put it in the oven, and then quickly microwave my rice.
Can I tell you actually, one of the things I do, and it's the quickest way, like this is basically my lunch most days, is I buy beans. I love beans. I recommend everyone adds beans to their diet. Now, I don't recommend doing this if you don't already eat them because your gut needs time to get used to having beans every day. Yeah. But in my case, it is definitely part of my everyday diet. So I buy beans. I adore Bold Bean Company because what they have done is they have made beans so delicious, so easily, but you can use any bean that's affordable to you, okay? So whatever you have available, beans in a tin, in a jar. You don't need to soak them. They're ready to go. You can have them cold if you want, if you're that much in a rush, which sometimes does happen to me. But you put some beans in a bowl, chop some onions. It doesn't matter if they're spring onions, red, whatever you want. Chop some onions. If you like tuna, you can add tuna. If you like feta, you can add feta. Whatever kind of
like protein you want to add.
It's not even protein because beans are so full of protein, but for me, it's actually about the flavor. It's like a little bit salty. So anchovies, like things that have a little bit of an umami salty situation going on. Add that in, and then add any leaves. Is it spinach leaves? Is it a bit of cauliflower leaf I do eat? Is it kale? Is it whatever you have in the fridge? If you don't have it in the fridge, do you have some frozen spinach? Can you just defrost that quickly? Chuck it in, mix it all up together. Plus points if you have some grains that you've cooked and you've kept in the fridge, or maybe you have the microwave rice also have mixed grains ones. Yeah. You've made lunch in literally 4 minutes.
Yeah.
That's it. That is a nutritious lunch with everything you need to feel good, be able to concentrate and not feel hungry in about 5 minutes time because you haven't had enough food. Then you can add to that. You can add even more. If you've got mixed seeds, add those in. Handful of nuts, add it in. But, we're talking about making meals that are really filling, they're nourishing. All these ingredients are very affordable. So beans are famously cheap. Whole grains, when they're dried, also famously cheap. You can definitely just batch cook them once a week. They'll keep in the fridge for 5 days. So I think we also need to break down this idea that eating well or eating healthily, it doesn't have to be expensive and it doesn't have to be time consuming. Because processed foods like tinned beans and jarred beans are brilliant for our health. Frozen fruits, frozen vegetables, they don't have a detrimental impact on health. And they are literally there to make our life a bit easier.
Yeah. And I do think some people listening will not identify the delicious meal you just said, and I'm definitely making after this podcast, as lunch. They will be used to grabbing a meal deal of a sandwich, crisps and some fizzy drink. And that actually is quite a hard shift to make. But It is easy.
Yeah. Actually, do you know, I usually recommend starting with breakfast as the change.
Yeah.
And the reason why I do that is because most of us have the most power over our breakfast.
Yes.
So we're either at home.
You're ahead of the day.
You're ahead of the day. You're either at home for breakfast, or if you're somebody who eats a bit later, you're at home in the morning and you could technically take it with you.
Yeah.
And so for me, it's like, start with that. If lunch seems too far, it's too much, then start with breakfast. Set yourself up for the day. And there are so many portable breakfast options. I've done so much fun work. I remember we did a shoot with Davina McCall for Zoe, and I was like, she's always on the move. Yeah. She was like, what would I bring with me? And so there I was with these jars, and I was like, you can make overnight oats, you can make a yogurt pot, you can do all these things, bring them with you. You can put, carrot and cucumber and celery sticks, put hummus at the bottom, extra virgin olive oil, nuts. We had this lineup of jars. You don't even need like fancy lunch boxes. It's just something you can create at home, pop it in the fridge, grab and go. Boiled eggs, some spinach, and you can take some crackers with you. Like, there is so many options, even for those who don't have the physical time in the morning.
Yeah.
And you don't have to cook it in the morning either.
Yeah.
You can pop it in the fridge the night before, and then in the morning you just have to open the fridge and grab. So I think for me, breakfast is one of those things that it gives the agency back. It's like, right, I'm going to do this. I'm at home, or I'm going to grab it and take it with me. And then you're not left, starving kind of at work or on the road and suddenly looking around, scrambling around for something.
And it ends up being biscuits or something in the office.
Oh yeah, or like a croissant from somewhere that's like delicious for about 5 seconds and then so hungry straight away.
Yeah.
So, there's obviously space for us to enjoy croissants, and there's space for us to enjoy these foods. The problem comes when these foods become the primary source of our energy, the primary source of our nutrients.
Yeah.
We know that these ultra-processed foods, they're lacking in nutrients. So whilst you might be getting enough energy, you will not be getting enough nutrients. And so here we are with this very weird dichotomy at the moment of people who are overweight but undernourished, in the sense that they're lacking essential nutrients. There's a double burden of malnutrition is what we call it in public health. And it's a weird concept, but it's now one that is becoming almost, it's a global problem. So all over the world, we're seeing this. Countries that have switched over to a more Western diet are starting to see this. So countries that traditionally were undernourished and malnourished are now seeing the double burden as well. So they're still undernourished. They still have a lack of nutrients, but they are overweight or suffering with obesity.
I remember having this issue, and my best friend will not mind me sharing this story. At university, she just seemed to eat crap, and she was always really slim. She had a great figure. She still does. But she used to eat crap. She eats much better now. And I used to eat really healthy and did not look like her. Yeah. And it was interesting, isn't it? Because we associated, and some people still do, health with a certain body shape. Yeah. But actually, my diet was more nutritionally rich.
Yeah.
And it isn't all to do with how we look and calories.
Gosh. No,
I wish calories didn't exist.
Do you know, calories are a useful metric for research, right?
Yeah.
But I people who are really keen on calories, I say to them, okay, that's fine. But do you know how we calculate? Firstly, they were calculated like over 100 years ago for foods, and food has changed a lot since then. And of course we can recalculate them, but they're calculated in a bomb calorimeter, which is essentially this weird contraption where you have the food, you set it on fire, you pop it in this glass container with water around it, and then you measure the temperature change of the water. And when it gets to a certain change, that's a calorie. It's like, how has that got anything to do with food and how we use it? Like, it is one measure of one aspect of food.
Well, it doesn't tell us, I guess, if something's 100 calories, I might metabolize that differently to you. Yeah. And depending on what else I'm eating it with, I might absorb different nutrients from it.
Absolutely. So that's the first problem. So the first problem is that we all utilize energy differently. Mm-hmm. We all have like different base metabolic rates. So we all burn energy differently just being alive, let alone how we move. So there's a problem with that. But there's also a problem with the fact that calories tell you nothing about nutritional value. They don't tell you anything about how the food is going to taste. They don't tell you anything about whether that food is going to help you in any way. So there's a real problem with, I don't want to say that calories are useless or that we should never have them, because I think they have been a useful tool for research, and they still do give an indication of one aspect of food. but they don't give an indication of how that food is going to affect you. That's my problem with it. And calorie counting is miserable. And people who are fixated on calories very often do not have a good relationship with food, and very often do not differentiate the nutritional value of foods. They are just so focused on the calories that they forget about the quality of the food. What are you eating for? So I think it's really problematic. And your example is really interesting because, especially when, young women, and especially growing up when we did back in the early noughties, I'm assuming you're roughly my age. You're probably younger than me actually, but there was a very big diet culture, and it was exactly that. It's like, if you look slim, then positive.
Yeah.
And actually, we're all different shapes and sizes from birth. So this idea that we could all be the same shape or size is ludicrous.
Yeah.
It's not going to ever happen. So what's healthy for you is different to what healthy looks like for me. It's different to what healthy looks like for friends and family. Like, everyone will have their own vision of health.
Love it.
Couldn't help myself. But yeah, so comparison is the killer of joy, but also it's useless as a metric for health. And we do get away with that kind of eating behavior when we're younger, but actually there is also this growing trend of people who are really quite slim. So their BMI is low, but their metabolic health is poor. So people who develop type 2 diabetes without overweight is actually quite a large proportion. It's not, as I was surprised to find out, and different areas of the world have different proportions of this, but you can be slim and develop type 2 diabetes. A lot of that is to do with where you're storing fat. So visceral fat storage around your organs and your middle area, that's really harmful for our metabolic health. And you can be one of those people that has a higher visceral fat, lower lean mass. So again, our lean mass, our muscle is an important metabolic organ, but perhaps not that much fat distributed around your limbs. So you look quite slim and actually look pretty healthy from the outside maybe, but that's not what's going on the inside.
I have so many questions that just come into my head. Okay, first one is, do you have a framework for someone listening that is used to counting calories? How can they eat that leaves calories behind? What should they be focusing on?
Okay. Yeah, so there's a few ideas. So at Zoe, we like to encourage people to focus on counting their plants. So can you get to 30 plants a week? And it's, I'm a massive fan of positive nutrition as a tool. And what that means is that what we should be focusing on is what we should be adding back into our plates as opposed to what we should be taking out. So this beautiful paper from The Lancet, which analysed over 150 countries' data. I mean, crazy analysis. Wild. I don't know who the researchers are, but hands off. And they essentially listed all the dietary factors that contribute to early death and increased morbidity, so being unwell. And when they broke it down, the things that were right at the top, the first one was a diet high in sodium. And that's no surprise for you as well, because hypertension is the biggest risk factor for death globally. So heart disease is still the number one killer. And we know that a diet high in sodium contributes directly to that hypertension. And it's interesting though, because how has the sodium crept up over the years?
Because it's added into all sorts
of foods. Yeah. I mean, breakfast cereals have added sodium. So foods that you wouldn't even expect because they're sweet, right?
Yeah.
And so that's one, that's the top. Then right directly underneath that, from the narrative we hear, you might think that number two biggest contributor to deaths is eating more bacon. It's not actually, right? The number two is a diet low in whole grains. Okay. Who eats whole grains every day? In the UK, nobody does. When I do talks, sometimes I say, who eats whole grains every day? And maybe one person sort of puts their hand up, okay, what's your favorite whole grain? And they're like, I don't know. And we've just lost touch with eating whole grains.
Yeah.
Because grains are very often processed for us into pasta, into bread. And whole grains, again, going back to what we spoke about earlier, they're very cheap. And you buy them dry, you soak them a little bit, you cook them, put them in the fridge, ready to go. Buckwheat, barley, quinoa. There's so many delicious ones. And fricassee, you can go wild. Depending on where you live, you can get access to so many amazing, amazing whole grains. I love barley the best, to be honest. So that's number two. Then you have a diet low in fruits. Fruits have been demonized left, right, and center. we saw the headlines. Is a banana like a Mars bar? Like, absolutely, please, please. We don't eat enough fruit in this country. Fruit is wonderful.
Yeah.
It is a portable snack. It is also essential for health. So having fruit as part of your diet is really important. Important caveat there being that it should be whole fruit. Fruit juices are not fruit. Dried fruit is also not really whole fruit. So like, let's stick to the fresh whole fruits.
Yeah.
Frozen is great too. And add those to your diet. Then number 3, you go through the list and it's basically whole grains, fruits. There is legumes, nuts and seeds.
I'm obsessed with nuts and seeds. I put them on everything.
As you should.
Yeah. Honestly, that's my new thing this year. I'm like, sprinkle a little bit on.
Sprinkle it all on.
Avocado toast, nuts and seeds.
100%.
My breakfast bowls, nuts and seeds.
Thank you. I'm so glad to hear it. It adds texture.
Yeah.
It adds flavour. It adds so many nutrients.
And it
adds
keeps you fuller for longer.
And protein, yes. So adding those back in. I mean, nuts were demonized for such a long time.
Yeah.
They'll make you fat. Nuts are so protective for health.
Yeah.
They're especially protective for cardiovascular, heart health, and brain health. There are so many studies. Please eat more nuts and seeds unless you're allergic. Please don't do that then. But so there's all these dietary factors, and you go down, then it's diet low in omega-3 fatty acids, diet low in polyunsaturated fatty acids, and then you go down, and right at the bottom, diet high in red meat, diet high in processed meat. So it, of course, yes, they are still contributing to an increased death, but it's nowhere near as important as concentrating on adding the things that we're low in back onto our plates. So how do we move away from calories? Move towards what you should be eating more of.
Yes.
Forget the calories for a minute. All these foods, right? Whole grains, leafy greens, vegetables, like beans and lentils, nuts, they are nutrient dense foods. And for the majority, nuts and seeds being the sort of notable exception, they are also low in energy density because they contain these amazing nutrients, but they don't have a huge number of readily available sugars. And actually, even in nuts, they're really hard to chew. So how much energy you extract from a nut varies widely from person to person. Yeah. And it really varies by how much you chew them. And how many enzymes do you have in your stomach that break that specific barrier down to absorb the sugar. So it really, like, don't worry about nuts being a bit more energy dense, because we know that actually eating nuts every day contributes to maintaining healthy weight. So all of these high volume, high nutrient density foods, cauliflower, broccoli, spinach, kale, like, you know, they're high volume, they're big on your plate and they're high in nutrients, but they have low energy density.
It's very difficult to overeat broccoli.
I would argue that it'd be like you'd have to be in one of those weird food competitions.
Yeah.
Very hard. And also when you add these together, so when you have the broccoli and the beans, and maybe you've put some kale in there, and you've got tomatoes, mushrooms, I love mushrooms. You've got a delicious meal. Yeah. And it's going to be very filling. It's going to have a high protein content, a very high fiber content. It'll keep you feeling full. It'll nourish you. And you don't need to worry about calories because it's completely irrelevant.
I feel like we're in a food revolution. This is the first time that, particularly as women, we are being told to eat more food.
Yes.
Focus on what we're adding in and not cutting out this food group, demonizing this, lowering carbs, lowering fat. Yeah. It's the first time we're actually being encouraged, eat more. Yes.
And I think that's one of my core messages is eat more food. Add more food to your plate, and abundance is key. Now, some people may say, oh, that's really irresponsible. We have an obesity crisis. But actually, I would argue that if the message is really clear that when I say add more food to your plate, we're talking about these foods.
Yes.
I'm not saying, what I'm definitely not saying is like add more donuts to your plate, or I'm not saying add more of the ultra processed meal deals to your plate, or add, that's not what I'm saying. When we focus on adding more of the foods that we know are beneficial for health to our plate, firstly, it displaces the other foods. Because going back to this idea, I'm not saying that we should never eat a croissant. I'm not saying we should never have Ben & Jerry's, my personal favorite. It's just that if I go and grab some Ben & Jerry's because I fancy it and I've had a nourishing meal, I will have a little bit of Ben & Jerry's, but I'm actually going to be quite full up. Yeah. So I will stop eating it.
Yeah, absolutely.
And put it back in the freezer. But if I'm starving because I've been depriving myself all day, I haven't had enough food, I haven't added anything to my plate, my body is literally, hangry with me, then I'm much more likely to get through at least half the tub. Yeah. Because I'm hungry. So it's all linked.
Yeah. I think one thing as well, people think is, well, none of these foods that we're telling them to eat more of are the really tasty, enjoyable foods. But also there's like spectrum of those less healthy foods. You know, for example, if you take a piece of cake or a shortbread or something, if it's homemade, it's entirely different to the ones that last a year on the shelves as well.
Yeah, it's true. And it's actually interesting because in the Mediterranean dietary pyramid, which is a really great place to start for anyone who's curious about what could a healthy dietary pattern look like, have a look online for the Mediterranean diet. There's pyramids. It tells you like what the majority of your food should be. And at the top of the pyramid, so the smallest bit, there are homemade cakes and sweets for celebrations. They're crucial for social events. Yeah. They're also crucial just to have at home if you fancy one, right?
Yeah.
But you're exactly right. If I've made my own cookie at home, it's going to be really quite different to a store-bought cookie that's going to be on the shelves for a year and has been industrially made. And I'm often surprised by how quickly and easily you can make these things at home. So I've got 2 young daughters at home. They're obsessed with baking with me because it's fun. There's flour, there's things happening. And it's so easy to make a simple cupcake recipe much more nutritious for them, as opposed to the fairy cakes you might buy in a store that really have no nutritional value, right? I still want them to enjoy these things, but if I make them at home, then I can actually make them an opportunity to add nutrients to their day. Yeah. And it takes all of about, 10 minutes to make them and maybe 7 minutes to bake them. So it's literally, it's building that into, maybe it's the weekend or when you have time, maybe after school one day if you're home with them. But even for yourself, if you're somebody, I went through a phase where I really enjoyed oat and raisin cookies.
I love an oat and raisin cookie.
And I was like, you know what? I really fancy them. I'm going to make them.
Yeah.
And they're so simple to make.
Yeah.
And I made them. I would make them and keep them in a jar at home and just enjoy them even more knowing that I made them actually.
Yeah.
So I'm not suggesting that we shouldn't eat these foods. I'm just saying that nourish yourself first. Like the priority is to eat nourishing foods.
Yeah.
And then if you do want to have that extra thing that you love and that you fancy, of course, by all means have it. But if you can make it at home, then that will be better.
I think the message is about being conscious that you're eating these foods that are less nutritious out of choice for the taste and the enjoyment, not relying on them because that's just what you eat for breakfast and you don't even think about it.
Yeah, it is. And it goes back to the food environment. We've been in this position where it's become okay to grab a biscuit that's like a weird crunchy biscuit as breakfast. Like what? No, that's not breakfast.
No.
And so it's just about unlearning that and taking a step back and seeing food for what it is. It's this opportunity to nourish ourselves. It's an opportunity to bank some health now for later, for when we grow up and we become older. And it's also an opportunity to actually enjoy, because often I think, people are wary that the kinds of foods that I'm talking about might not taste good. But when you really get stuck in and you maybe try some recipes and you use spices and you use herbs and you flavor your food, and where possible, you cook things a bit longer and a bit slower.
Yeah.
Just makes things taste extra good. It's so delicious. The food is both delicious and nutritious.
Yeah.
The food that I'm talking about isn't going to leave you thinking, oh God, that was so bland.
I always think this when I go to Ottolenghi salad bar.
Yes, yeah.
And I think the broccoli that I eat is nicer than any cake I've ever eaten.
Yeah.
I'm like, what do they do to these vegetables?
Yeah, it's so true.
They taste amazing.
They do. And there's, sometimes it's really simple tricks.
Yeah.
There's amazing chefs that work on this. It's like the acidity with the something else. And so it's sometimes combinations that are so simple. Often people say to me, I can't stand kale. It just tastes gross. And I'm like, actually, it's all about the dressing.
Yeah.
And if you can massage your kale, and that sounds really weird, but it improves the texture a lot. And then all you have to do is just grab some extra virgin olive oil if that's not available to you. Then add a little teaspoon of mustard or half a teaspoon of mustard. Then either some apple cider vinegar or whatever vinegar you have at home actually. Shake it together and this delicious, creamy dressing is ready. Put some pumpkin seeds and then massage. And actually what you get, bit of salt if you're into salt, bit of pepper. it's so much nicer. Of course, if you're trying to eat like kale out of a bag,
or like boiled kale with nothing on,
with nothing on, it's not going to taste great.
Yeah.
And Ottolenghi is amazing, but crikey, I mean, I find his recipes quite tricky.
Well, you need like
55 ingredients,
like elephant breath to put in the recipe.
and people who have time and amazing, like Ottolenghi recipes are always brilliant.
Yeah.
But there's also this middle ground, which is not just boiled food, but not quite Ottolenghi, but this sweet spot in the middle where it's doable by anyone, tastes great. And I think being Italian, simple food is like at the core of our cuisine. And it's a great example of how you can just make things taste really delicious with very little.
Yeah.
You don't need complexity. I am your classic. I am a 15 to 20 minute meal person. Like I do not spend more time than that because I like quick meals. I like throwing things together. I'll open the fridge and just be like, zoom, and just put it together. Then there are people who love recipes and love the process.
But you're better spending 15 minutes more often than seeing it as this big effort and this big slog that you only do on a Sunday.
Yeah, exactly that. Yeah.
I wanted to ask about the Mediterranean diet. Everyone's heard that this is the ideal diet to follow. Do you think it's because of the ingredients or the foods that are included in the Mediterranean diet, or because it omits other food?
I think it's a bit of both, actually. So the Mediterranean diet is really, it's a dietary pattern as opposed to like a diet. It's surprisingly not that prescriptive on the foods. It's more prescriptive on the pattern. So the Mediterranean dietary pattern has been translated into all sorts of cuisines. You can apply it to whatever food you like in terms of where the actual vegetables are from, for example. So they've created the pyramids for Southeast Asian cuisine, for Eastern African cuisine, so you can apply it anywhere. And it's this idea that the base of the diet, the majority of the diet, is whole vegetables, whole plants, whole grains, pulses and legumes. That's the base. Then you have the next layer is like having extra virgin olive oil, some oily fish in your diet, nuts and seeds, lots of nuts and seeds. And then as you go right to the top, there's some occasional poultry. Poultry and eggs are less featured. Right at the top, red meat, and then homemade sort of sweets. And then you have the extra virgin olive oil in abundance all over the place. And the extra virgin olive oil is the one ingredient that doesn't seem to be replaceable with other oils. It is that. And I think it's what's on it, as exactly as you said, and the combinations. So there's some really fascinating side. I sometimes go down these rabbit holes, and I had a day where I started really looking into the science that's being done around what happens to sofrito when you fry it. So this is the onion, garlic, celery, carrot, and tomato base that's featured in so many recipes in the Mediterranean diet. What happens is that like there's polyphenols that change. There's helpful plant chemicals that change during low heat frying in extra virgin olive oil that seems to confer some of the health benefits of sofrito base. So there's some really cool food science that's being done around the way the ingredients interact. And what's really critical is that by combining these types of plants that are so heavily featured, so the whole grains with the pulses, with the legumes, with the nuts, with the seeds, with the leafy greens, with the spices, you get this variety of nutrients and this huge variety of chemicals that all interact to create like a beneficial universe for our bodies. And they also provide a full amino acid profile. So the question I get asked a lot is, but if I eat more plants, how will I get complete proteins? And I'm like, what? There's complete proteins in every plant. All 20 amino acids are in every plant.
Wow.
It's just that they're there in different proportions. So if you want to make sure that you're getting enough of each amino acid at the level that is needed for optimal function, you just need to eat different plants.
Yeah, diversity is key.
Diversity is key. That's why the 30 plants a week message has really taken off and it's become much more favored than the 5 a day, because it just communicates the importance of that diversity and that range and helps people think outside of my banana, cucumber, lettuce, tomato and apple, right?
Yeah.
What else do you need to add to your plate to not just have those 5 every day? So that's where you get the magic of the alchemy of the different nutrients and the different foods working together. Now, in terms of mechanism, I think the most compelling evidence I've seen is the effect of the Mediterranean diet, in its high fiber. So the fact that it's high in fiber and high in these really beneficial oils and fats from fatty fish and extra virgin olive oil is really helpful for maintaining healthy weight. And also a lot of these foods that we're talking about, the legumes, the whole grains, and the fatty fish, high in protein. So that dietary pattern helps you to feel full and reduces the likelihood that you're going to overeat, essentially. So maintaining a healthy weight. And then in the gut microbiome, where these trillions of microbes live and they thrive off of what we feed them, that's where the magic happens with a lot of these polyphenols and the fiber. And so the interaction between the Mediterranean diet and the health outcomes that we see, there's been a couple of really wonderfully designed randomized control trials where they've actually seen how the health outcome that we're measuring was mediated from the Mediterranean diet by gut microbiome changes. So we can actually now do the science to say, okay, the ingredients that the foods that people are eating with this Mediterranean dietary pattern is directly impacting gut microbiome composition and what they're making for us, the gut microbes. And that's having the health outcome that we're measuring, which is so exciting. Well, for me, it is.
It's exciting for me
it's
too.
It's really cool, right? So we now have it, because you're right, for I guess for a while it was so beneficial, but why? Like, what is it? It's so beneficial. It's so helpful. It is better sort of research than any other dietary pattern. The DASH diets had a lot of research on it too, but Mediterranean diet just blows it out of the water every time.
So all these benefits of including these foods and how they impact the gut microbiome. You mentioned in your book, everybody should know this, about how crucial the first 1,000 days of life are in establishing, those populations of bacteria, viruses, everything in the microbiome. Does that mean it's ever too late to make these changes?
No, absolutely not. So you're completely right. The first 1,000 days is really important, and it's something that I just hope more people will know about because it's not spoken about at all, actually, in public. It exists in research, it exists in academia. It's this ivory tower effect. But actually, when you speak to people outside of that space, it's not well understood. It's not well conceived. It's like this idea that actually what we eat between conception and second birthday is really critical. Now, just because that time period is so important, it doesn't mean that then the door shuts and we're done. It's just the goal is called the golden window of opportunity because so much happens in that time. So it is, in terms of nutrition sensitivity, like what we do in that time can have a really big impact. However, there are other windows of opportunity throughout our lives. And we know that dietary change can impact a significant effect and a clinically relevant effect. Because, of course, there are also sort of scientifically relevant or statistically significant outcomes. But what we're interested in is outcomes that actually make a difference to the person's lives. And you see that across the lifespan. I mean, one of my favorite studies, I'm forgetting the name of it now, which is really annoying, but it was a study done in a care home where they took a group of older people with, I think the age range was like 70 to sort of 95. And they had quite high frailty. So frailty is what happens for older people when they get to a point that they have very little bandwidth for something to go wrong. So even a common cold can really be quite serious.
Yeah. Like flu can cause death for old people.
And yes, and frailty is one of these things that we can actually work to improve, right? And prevent. So this RCT, this randomized control trial, was looking at if we give this group of people a Mediterranean dietary intervention, can we actually see improvement in frailty markers? One of them is grip strength. There's these tests you can do, like from a chair, you stand up when you walk and you see how long it takes. So all these kinds of tests, cognitive function. And they found incredible results by just doing this intervention, this dietary intervention in older people in a care home over, I think the testing period was 12 weeks. So we're not talking about, it takes years.
Yeah.
No, even in your 80s, if you want to improve your health, you can make a dietary change that will significantly improve how you live your life day to day. So yes, of course, preventing death, preventing disease is super important.
Yeah.
But we also want to just feel better today, right?
Yeah.
And diet has that power. The food choices we make every day have the power to impact how we feel today, plus the impact to prevent disease and to make sure that we feel better tomorrow. And that's, so I think the first 1,000 days, super important. I'm very passionate about it. But the opportunity to improve is there the whole time. And hopefully when you read the book, that's what you'll get, is that it's never too late to make this change. There's some beautiful modeling studies that have suggested how many life years you can add by making dietary change. In your 40s, one of the estimates is that you could add up to 10 or 11 years to your life. Wow. That's really cool. In your 70s, you could add 6 to 7 years in the same modeling study.
I mean, can we just take a moment to think about that? So if you change your diet in your 40s, when your routine's established, you're set in your ways, you found out what you like and you don't like, you can add 10 years to your life.
Yes. So like, I think most of us would agree that that'd be great. Yeah. And we're not even talking about a dietary change that's outside of the realm. So like another thing that I'm not a fan of is this idea that you have to be, like, I hate the term biohacking.
I don't like it either.
It's like such a bizarre concept to me.
For me, the reason I think I hate the term is because it feels like you're doing something out of the ordinary, like unusual, when really all it is living as healthily as you can.
But often biohacking does include practices that are bizarre at best, let's say, dangerous at worst. But also, like, who do you think you are that you can hack our biology? We have literally evolved over millions of years. Your supplement is not going to do that. Let's be super clear. If you want to improve your health and you want to improve how many years you're going to be on this planet, the best way to do that is to embrace the power of food and nourish yourself every day to get to that. It's as simple as that. You don't need to, I don't know, I've seen like there's a new one now, right? The ozone therapy, where they like take the blood out of your body, put it through ozone therapy in a machine, and then what are we doing? It's like dialysis, but for people who don't need it.
Yeah.
And I think, it's beyond me how we've come so far, where actually just repairing our food culture, putting pressure on our government to improve our food environment. I'm not saying that, as I said, supermarkets, of course they want to make money. Food industry, of course they want to make money. We're all for that. Let's do it. But we can still have things in place to make sure that the food environment is healthy.
See, this is what always baffles me when my patients get admitted to hospital, which they do because they're oncology patients. And I ask them what they ate when they're in hospital and how many times they got out of bed when they're in the hospital. Yeah. And I get so frustrated with it because exactly like you've just said, that few weeks of what they're eating does make a difference. 100%. You can change how you feel and your outcomes from just changing your diet for a couple of weeks. And often when people get admitted to hospital, it's a negative change.
Yeah, which is really sad. There's really sad data when you look at how people's nutritional status declines in hospital stays.
And losing 10% of their muscle mass a week.
And in oncology, right, in cancer, my understanding, you can correct me if I'm wrong, but muscle mass is critical for survival. Critical. So how did we get there? Yeah. And it's that combination of not having the resources, not having enough staff to even implement that change. But really, if we wanted to make sure that our patients in hospitals, our children in schools, these critical places where vulnerable people are at the hands of what is given to them, right? Care homes, that should be a priority for me. Like, we can make a huge impact on the health of the nation if we actually intervene in schools, in hospitals, and in care homes.
Do our nutritional needs change throughout our lives? Because I think I heard you speaking about this, and people come to you and say, but I'm eating the way I always did, and I've moved the way I always did, but I'm gaining weight, or I'm not losing weight, or whatever. Yeah. Do we have changes in our nutritional requirements? Yes.
So, we've kind of touched on this idea that we all change. So, who I was 10 years ago is different to who I am today. I've had like 2 kids in between. There's been a pandemic. So this idea to me that we are the stagnant being that never changes is a bit ludicrous. Like, of course we've evolved. Yeah. If you're lucky enough to live long enough to change, then you will have changed. Your physiology will have changed. Your metabolism will have changed. Hormone levels change. Like, there's so many changes that happen through exposures, so through what you've been through as an individual, but also through just the aging process, which is also different for everyone, right? We all age at different rates. We start from different starting points. So for me, like, what I would hope this book does is help people to embrace that change, because I think I said this on TV on This Morning and Ben's face, if you're still alive, you've changed. Yeah. If you haven't changed, it's because you're dead, right? Yeah. That's when we stop changing.
Yeah.
So embrace that change. Know that you're supposed to change.
Yeah.
And it is slightly different for males and females. Females have this really monumental change with the menopause in terms of hormones and physiology. Whilst men's is slightly more gradual, but we all go through change day to day, week to week, month to month, year to year. And there are things that can really accelerate that, or it can be quite steady. But if we can get that message sort of in our mindset, then it means that when I realized that actually those trousers I was wearing don't really fit me very well anymore, and my body shape has changed, instead of resisting it and then punishing myself because I don't fit the trousers anymore, or because the way that my shoulders look isn't the same, or what, instead of punishing myself, I'll go, okay, cool. Something's changed. Like, first, I'll take stock. Do I need to change something? Is it something that's happened? But also, I'm going to give those clothes to charity, and I'm going to buy some other clothes that do fit me and make me feel good, because sometimes the metrics we're using are so bizarre. And often, unfortunately, especially with women, it is weight and it is dress size. And, I have women who will proudly say to me, oh yes, I'm wearing the same jeans I wore when I was 18. And I'm like, okay, cool. I mean, but that's not, how is that something
it's not a measure of health
or pride?
Yeah. I really have this frustration with girls that are going through puberty, and then similarly women that go through menopause, and the physiological changes that happen and the hormonal changes mean their body changes. We know that girls going through puberty gain weight, and we know the same happens when we see the drop in estrogen at menopause. And it's faced with, like you said, resistance of that change. And it means that people deprive food. And actually, you need to fuel this huge physiological shift
100%.
Of puberty and menopause to allow the changes to happen as they're supposed to happen.
And to make sure that you're healthy throughout, that you actually avoid the symptoms that can come with it and that can make the change more challenging.
Yeah.
And it's interesting you point that out, because adolescence and perimenopause are the 2 points in life when women are most likely to start displaying disordered eating. And it's because there's this culture of resisting change. So I hope we can get past that, and I hope we can embrace change and start to actually work with that change and say, okay, let's see where I am. What can I do now to support myself? So throughout life course, there are some major trends. So I try and break these down. It was actually quite a monumental task to pick them in the book, but I try and break these down by major groups. So, and major sort of trends in prevention. So I talk about how men are at higher risk of heart disease. So really for men, it is quite important to start thinking about markers of heart disease in their 30s, because the next 20 years are where you'll really see that difference between someone who has been able to prevent and someone who hasn't. For women, as I said, like the perimenopause and menopause presents a really challenging time. Not for all women, 25%, no symptoms, but for many women, they will notice, right? Majority will notice. And so how can we prepare for that? We've got some emerging data, some emerging science, like menopause has historically not been well researched. That is changing, which is super exciting. And in the Zoe menopause study, we saw the true physiological differences. So we had this amazing opportunity to analyze women's data in premenopause, perimenopause, postmenopause, and we had age matched male cohorts. So we could basically really see like what's age related and what's related to menopause change. And within each cohort of women, there was lots of different age groups. So we also age matched. It was really interesting. And we saw that postprandial responses for both blood fat and blood sugar were very different, and insulin. But we also saw a really big shift in the gut microbiome, which is fascinating. So we talked about earlier this idea that gut microbiome mediates some of the positive impacts of diet, and it can also mediate some of the negative ones, right? If you have gut microbes that are not that helpful, then the postbiotics they're producing are not that great for you. And so it's important to remember that just knowing the diversity of gut microbes in your gut doesn't give you an indication of what they're doing. What we're really interested in and what we're leading on at Zoe in terms of microbiome science is understanding which microbes are responsible for healthier outcomes and which are responsible for less healthier outcomes. One of the big research grants are involved in this prospect. So the Cancer Research UK,
Yeah.
trying to identify gut microbial signatures that are actually predictive of colon cancer.
Yeah.
Really amazing and important science, right?
Well, I read a study, it was very small, maybe 13 patients, and it was talking about how, I don't want people to quote this study because it's so small, it's not applicable to everyday life yet, but how we had responders to certain immune therapies that we use for cancer and non-responders, and they looked at their microbiomes. And when they did a fecal transplant, so transferring the microbiome of a responder to a non-responder, the non-responder started to respond.
And that's amazing. There was a large trial that Tim Spector led where they did a Mediterranean dietary intervention, pre-immunotherapy, Mediterranean diet, and the arm that received it had much better response. Wow. So you don't even need to go as far as a poop transplant. You can change the microbiome by changing your diet.
Absolutely. And it's never too late.
And it's never too late. And cancer prehab is a whole other topic, which is really interesting. But so we know these physiological changes in menopause. We know the microbiome might be mediating it. And what we also know is that women who reported eating lots of whole plants in their diet were much less likely to report all of the main symptoms of menopause. And so now what we're doing now is we're going to see, I can't tell you more about the data yet, but it's exciting. We're seeing whether actually kind of intervening and helping women change their diet towards a more plant-focused, all the things we've talked about today, diet, can that actually reduce their symptoms when they're already in it?
Yeah.
So can we actually improve women's health and then reduce their symptoms of the menopause whilst they're in it with dietary intervention?
So it's not just preventative, it's also as a kind of treatment management.
Yeah.
Absolutely. So you're head of nutrition at Zoe, which has honestly taken the world by storm. The blood glucose element of Zoe does seem to split opinions.
Yes.
When do you think that monitoring blood glucose is relevant and when may it be less helpful?
It's a really good question. So the way that we use CGMs, so continuous glucose monitors, which is where we get this data from in Zoe, is very different to how it's used, for example, in diabetes management. So in diabetes management, people living with diabetes have to wear continuous glucose monitors every day to help manage their glucose levels and if they are using insulin to know when to use that. At Zoe, we use the continuous glucose monitor for just a 2-week test period. And we use it because we provide every member with a test cookie. Now, the test cookie is designed to be a metabolic challenge, and it's based on the muffin that we use in all our trials when we created Zoe. So before the product was available, we tested everything we were doing in clinical trials. And it's designed to be a metabolic challenge in that it's high in fat and high in sugar. Now, what we use the CGM for is to see what your postprandial response is, so what your post-meal response is to that standardized test cookie. Why is that useful? Because we know that that cookie, which everyone eats fasted and without exercising prior, contains exactly the same amount of fat and energy for everyone. By measuring how your blood glucose changes straight after that test meal, and then straight after the second test meal the same day, and comparing your response to the over 100,000 people that are in Zoe now, that have taken part and that have shared their data with us for research purposes only, including this research, we can actually say, right, Frankie, for a woman of your age, your postprandial glucose response was within range, above, below, and this is what we'd expect for you. And now based on that, we're able to help you choose foods that are likely to not cause a metabolic challenge every time you eat them. Because challenging a metabolism every now and then is cool, but if you're challenging your metabolism every single meal, then what we see is this increased risk of dietary inflammation. Now, this is where the nuance comes in, where sometimes people say, well, you can just use fasted glucose levels, that gives you an indication. But what we don't get a picture of without the CGM is, what does your day look like? What is it actually doing throughout the day? So really important to note that we only use CGM for the testing period, and that's it. You do not get another CGM with Zoe. We then use the data from that 2-week period where you also then log your meals and you tell us a little bit more like, oh, I've just had a fruit salad, here's the glucose response. Or I've just had, my favorite pizza, here's a glucose response. I've just had my favorite salad, here's a glucose response. We take all that data and then we provide you with personalized food scores that are based in part on the blood glucose response, in part to your postprandial blood fat response, which we also measure using something called a tasso, which collects your blood, and in part with your gut microbiome score, which, as we've just sort of touched on, we calculate your gut microbiome score based on all of our members' data and health outcomes and dietary patterns. So it's really, the way that we've designed the score is really comprehensive, and really it's the best in the world. I would go as far as to say at the moment, right? We combine that information with what we know about your dietary quality. So before you start Zoe, fill out a full food frequency questionnaire, validated tool, and we also use that to assess your dietary quality, plus your background, how old you are. So all of that data goes into making your personalized food scores. It is not just the glucose element, and we do not provide continuous glucose monitors in the same way that they're provided for people with diabetes to monitor their glucose every day.
Because if someone was to eat, this is, I guess, where the question comes from. If someone was to eat a banana versus a piece of processed meat, the banana would likely spike their blood glucose more.
Yes.
But it's not worse for you.
No.
So how do people then apply that? Because I think the issue is it's not the technology that is criticised. I think it's some people don't know how to apply it.
Well, this is exactly why we then create food scores for you that are based on several elements.
Yeah.
So a piece of salami is never going to have a higher score in Zoe than a banana. Right?
Yeah.
Because it's not just about glucose.
Yeah.
So, we do get a lot of questions about this. And I understand if we were only providing glucose as this centric point, we could all just eat butter all day. Sure. Like, that is not what we advise.
Yeah.
It's just one element of quite a complex picture that goes into making the food scores that we then create for people that can then help them make smarter food choices every day based on their metabolic responses. So, and their gut microbiome composition, right? So it's just, as we talked about, the food environment is kind of not designed for health. It's a very noisy space. There's a lot of misinformation on nutrition. What Zoe membership offers is a clear, easy to use guide designed to your response. So that when you open it, you can say, okay, what should I eat today? Whether that is scanning a barcode in a supermarket, or whether that is, here's some ingredients, here's some recipes, here's how we'd combine them for you today. Here's your dietary quality over this week. Here's your dietary quality over the month. Here's your dietary quality over the quarter.
Yeah.
So it gives you this insight and ability to use it as a tool to improve your diet based on what we know about you as an individual. The aim is, and this is what we see in the vast majority of our members, is it empowers people to make that change for themselves and to create the kind of food environment and food architecture in their own home to support their health and to really often transform their health, actually. So for some people, it's quite an interesting way to just explore how their body responds to food.
And become more conscious of their food choices, I guess, which we touched on before.
Exactly. And actually, for some people, the continuous glucose monitor can give them an insight. So actually, a lot of the questions I get are, I went into the sauna and my blood glucose went up. It's like, yes, we would expect that. That's really interesting. I didn't know that. Or I went for a run and then halfway through my run, my blood glucose went up. I'm like, and that is your body doing its job. So it actually also starts to help people to engage with how cool their body is. And how it does mobilize energy stores when they're needed if you're doing something. So whilst I do understand some of the concerns, I think the way that we utilize them and what we're doing and also the science we're publishing on CGM use in people without diabetes is moving it forwards and becoming a helpful tool that in the way that we ask patients to monitor their blood pressure and to understand blood pressure and how it changes throughout the day. It's a useful tool. It's a useful metric to be aware of because it is so important for health. So,
and it's not telling anyone to fear a glucose spike. It's just learning how your body responds.
Yes.
Thank you for that. I'm very aware that we could speak for all morning, but I'm going to wrap up. One of the chapters in your book is Health is the New Wealth.
Yes.
How do people get rich?
I love it. So I would like to think of a health account. So imagine a bank account, but instead of a bank account, it's a health account, right? And for me, the way that you get rich, because health really is wealth, you can't buy good health. And for me, our health is really often very closely correlated with the amount of time we have with our loved ones, with our friends, just on this planet to do cool stuff. And time is the only real true finite currency. Can't borrow it, cannot buy it, right? It just happens. So the health account that you have, if you decide to invest in it every day and you have some compound interest going on, the more you invest, the more you will have in your health account.
Yeah.
And how do we invest in it? We've touched on this today. Everyday dietary choices. Every time you decide what to eat in a day, know that you can add more to your health account by eating more of these foods that we've talked about today. Move more. That will add to your health account. An important factor we haven't really touched on today, but is really critical and big part of food culture is social connection. So actually put that in with the food, right? Share a meal with your friends, share a meal with your family, share a meal with a colleague, or share a meal with yourself and a good book without any distractions. Just make that time to connect with yourself and your loved ones. Social connection. If you keep adding to your health account in this way every day with these choices, sleep also. I mean, we can't, sleep, it's a whole, I'm sure you have done a whole podcast episode on it. Sleep is also critical.
Yeah.
But by adding into your health account like that, that is how you get rich. And the true wealth, if you speak to anybody who is in the older years in their life, health is the thing that ends up being the most important, because when it's taken away, you realize how critical it is for everything we do. Mm-hmm. So I would love to see a world where people focus on creating so much joy for themselves by investing in their own health.
Yeah. Because
at the end of the day, that is the only account I really want to be rich in, to be honest.
I completely agree. I think that's a great place for us to wrap up. I'm going to ask you my final question, which I ask everyone on this podcast. Uh-huh. What is your vision of health? Yeah. What does health look like to you?
Oh, I think, great. My vision of health. It's really, my vision, for me, vision of health is someone who is joyful and enjoying their life, whatever they're doing. And that doesn't mean that you have to be happy all the time, by the way, like life happens, but it's just this ability to truly embrace life and appreciate all that there is to offer. And when you're healthy and when you feel great, it is so much easier to do that. So whenever I see someone who just looks like they're having the best time, it doesn't matter what they're doing, but they're really enjoying themselves. They're really joyful. They have this sort of happy, this glow, at any age. For me, that is a vision of health.
Love that.
Yeah.
Thank you so much for coming on the podcast. It's been a great episode. I honestly feel like we could go on and on. You've got so much knowledge to share. So I hope everyone enjoyed this.
Thank you so much for having me.
Thank you so much for listening to Vision of Health. I hope you've taken away some practical and realistic health advice that you can implement to improve your lifestyle and get clear on your vision of health. If you've enjoyed this episode, then please do let me know by liking the episode and leaving me a review. If you want to hear more from me, then make sure you're subscribed to the channel. And if you have any friends that could benefit from improving their lifestyle, then make sure you share the episode with them. I'll see you next time.